Hi Mary, I'm very happy that you're joining me for this biomechanical assessment. We will have two parts today. The first part will be that I will simply have like a visual analysis of your body while you're standing in a very natural way. And there's really nothing you have to do. You just need to stand, to relax, to breathe, be very normal and don't do anything specific. Then we'll have a second part in this, and this second part will be a little bit of movement tests. For these movements tests, it will be simple. It will be like, okay, take your arm up, something like that. Mm-hmm. The idea is not to be good. The idea is to show me really what is happening in your physical body, that I can see, okay, now it starts to be challenging, or maybe your hand starts to turn, something like this. So if something is happening in your body, allow it to happen, don't resist it. And if, in case something hurts, of course, or is giving you discomfort, you immediately let me know, all right? Yeah. And then once we have seen a little bit what's going on in your body, we will go into a couple of exercises, what you can do to correct a little bit what is going on.
Okay, great.
All right, so first of all, just find like a natural way of standing. Good. And I will simply go around a little bit as well and have a look at your body. Okay. You can just breathe. If you want to close your eyes for a moment, feel free to do so. So what I see, for example, is that your big toes, they are going a little bit inwards. It's a little bit stronger on the left side than on the right, but instead of going directly forward, they go a little bit inwards towards the rest of the foot. Mm-hmm. The same thing is happening with your pinky toe. Instead of facing forward, it is going a little bit inwards as well here. This is already showing me that your weight of the body is a little bit too far forward. So when you stand or when you walk, there's too much weight in front. So we need to bring the weight of your body further backwards. And when I look at your shins and your thighs, what I can see is that the thigh bone is going a little bit from outwards inwards. Mm-hmm. And then at the same time, the shin is doing a little bit of a bow here. Maybe when you look down, you can really see it, that there's a bit of a bow there and here as well.
Yeah.
Exactly.
I can see.
And like this, actually, there's like a little bit of a twist in the knee that is happening. So you can see like here it's going in and then it's like whoop, going out. And this is happening for you on both sides. If there's a difference between left and right, it's not very strong. Mm-hmm. Let me see it from a moment from the side. Exactly. Good. So I can see that your arch in the back is quite intense. Mm-hmm. So you have an anterior pelvic tilt. Yeah, you know this already?
Yeah, I know this already.
Okay, and let's see what's happening with the shoulders there. So when I touch here your shoulders, mm-hmm. I can actually almost grab underneath the shoulder blade. It's on both sides, but for me I feel like in the grabbing I can almost grab more on the right, but visually there doesn't seem to be much difference. Mm-hmm. Good. But what I see here is that the right shoulder is a tiny bit lower than the left one. It's not very extreme though. Would you say that your pants are right now in like a really equal position, left, right, everything? You feel equal?
The pants?
Yes.
I think so, yeah.
Okay. Because it looks like the right side and the back is higher. We will have a look at this in a moment, but it's something that is very common. This is why I'm asking. Mm-hmm. And from the front, it's the same thing. The right shoulder is a little bit lower, but it's not very strong. Mm-hmm. And I will just have a look at your face, so don't be confused about that. Okay, would you mind just doing this? Exactly. Okay. So I can see in the face that the left eye is a little bit lower than the right one. Mm-hmm. And when I see your teeth, I see that the lower jaw is a little bit pushed to the right in comparison to the upper one. Okay. So this will probably make sense in the end with all the rest, but it already indicates that there's a lot of compression in the front on the right side. Mm-hmm. All right. With this, could you take your left foot in front of you for a moment? Exactly. And then you just bring the weight of your body into the foot. So it looks like this. You bring the foot forward, you bend the knee gently, bringing the knee towards the second toe, and then you're just leaning forwards and backwards. Good. Yes.
I can lift it back here.
You can lift it up. Yes, exactly. Good. I will have a look from the back as well for this one. Do you feel stable when you do this?
Not so much. I definitely need to balance it out a bit.
Yes. Fiona. Okay. Let's turn around. Let's do it on the other side. And yes, you can go a little bit backwards, exactly, and you do the same thing there. Good. Yes. Make the knee face towards the second toe. Yes. Aha. Good. I see it from the back. How does it feel in comparison for you to step onto this foot?
Better.
Better?
Yeah.
Okay. All right, you can stop. So what I see in the difference between your feet is that the arch of the foot on the right is higher than on the left. This shows us that your right foot is having a bit of a difficulty to really push off from the ground. The left one seems to be doing it, but it is cheating at the same time. Because instead of doing the movement, when we have like a healthy foot, what is supposed to happen is that the arch of the foot is just going down and springing back up.
Yeah.
Instead of doing this, your foot goes much more inwards and then is lengthening out a little bit. So you're kind of collapsing inwards.
The left one or both?
The left one much more than the
Okay.
right one. And the right one, it's happening a little bit, but it's not very strong.
Yeah.
And on the right one, it's more the opposite problem, that the mount of the big toe starts to lift up. It doesn't, it's not really grounded. Like when you put the weight forward, you bring it a little bit down, but then immediately it's like, oh, you take it back up.
Okay.
So there needs to be some grounding work that needs to be done. All right, we will go onto the mat and we will do a couple of tests there. All right, I'll maybe step just one step back from the mat. I show it for a moment. You will be in this direction, that the face is towards the wall. And you will lie down like you would lie in Shavasana. This is important that the upper body is relaxed. And then you start from there with your right leg. You turn the toes up. Left leg is fully relaxed. And then you start bending the knee, relaxing the head, and you just bring it in as far as you can. We do this on both sides. And then the second test will be to do the same thing, but with the legs long. So first thing, turn the toes up. And then engage a little bit this thigh, other leg is relaxed, and you're just lifting it up. Okay, good. Let's try that. Maybe let me come here for a moment. Actually, I need to come down for that. Good. So relaxing the upper body, exactly, and then starting with the right leg, just turning the toes a little bit to face up. Good. And then lifting the leg slowly, slowly, slowly with control. Good. Lifting as far as you can. As far as you can. Good. Let's do it one more time. Make sure that especially the beginning is very slow. Going down, you can do it much quicker. Good. Nice, I like the control. Good. All right. Any impingement, anything happening in the hip there?
Well, now I can feel the resistance. I'm going to
Okay.
Other
Okay.
than that,
No? Okay, good. Let's see it on the other side. I will just change to the other side here. Let's have a look there. Okay, one more time. Good. Can you feel how the right leg starts to lift up?
Yeah.
And it looks for me more on this side than on the other, that you're kind of trying to counterbalance with the right a little bit without even noticing. Do you feel it's like immediately once you lift up?
I think I would need to do it again.
Do it again, yes. And really try to relax the right leg. Yeah, the right leg is already kicking in. Can you feel it? Okay. Yeah. Otherwise, how does it feel in comparison, the left and right? Is one side easier than the other? Or is it like same?
Do you mean how far I can go? Or just,
more like the sense of lifting, like one leg might feel heavier, for example.
Yeah, I think the left one
The left one?
heavier because the right one I can sense as well that it's trying to counterbalance, as you said.
Yeah, I mean on the other side it was happening as well, but not as strongly, I felt. Okay, let's do the one with the leg long. So you're turning the foot up, exactly. You engage the right side, but you release the left. And then with the exhalation, lift it up. Yes, this is normal if it's challenging. Good. Very good. Just go as far as you can, even if right now it means that the left one is lifting. Yeah. Good. Coming down one more time. We are going back up very slowly. One last time. Let me just come here for that. Yes, okay. Okay, you can stop there. All right. Let's do the other side first and then I say something about it.
Okay.
I might stay here for a moment for the other side. It might give me a better angle actually. So let's do the left one, yes. Good. Okay, let's come down one more time. I'll change just to the other side quickly. Let's do it one more time here. Okay. All right, slowly coming down. What was the sensation for you? Which leg is heavier, left or right?
The left one, because I can feel my heel pushing, my right heel pushing into the ground more.
Okay.
And I'm trying.
Yeah. What happened on both sides is that there was a little bit of a shift in the hips. So that the moment you were lifting up, I could see that the hip bone started to shift a little bit in height. So it shows us that even the beginning of the movement is not like genuinely happening exactly what we want, but that your body found a way to avoid the real movement. Which is very intelligent, but in the end it's not exactly what we want to do. Okay, I think for the next ones you will have to turn around for a moment so that your face is looking the other way because you need some space behind you.
Still on the back.
Yes, maybe go away from the mat for a moment. I will show it first and then you can do this. So you will lie down. Important here that the legs are still long, that you just relax them down. Arms to the outside and you fully want to turn the palm facing upwards. This is important. The arm should be long. If there's like a micro bend, it's okay, but you don't like fully want to bend. And then from there, you will start to lift the arm as high as you can. And you do this slowly. I'm doing it a little quicker now. And if you can go all the way to the ground, you go all the way to the ground. You do this on both sides. And then we will go into some rotational testing, which means you take the arm out to the side. The elbow is at the same height like the shoulder blade. You release the shoulder blade down. And then from there, you take the palm forwards as far as you can. And then backwards as far as you can. I'm only always showing a little bit, but you go as far as you can. All right, let's try that. Good. Exactly. Yes. Let's start with the right arm. Bring it a little bit closer towards the body. Yes. Good. As far as you can. Good. Any pain, any sensation there? No? Then come back one more time and we do it one more time there. Notice how the rib cage starts to lift. You feel it?
Yeah, I didn't notice before you said that.
Yeah. So first there's a turning of the hand happening, and then you compensate by lifting up the rib cage. Most people do this at some point.
Yeah.
Let's see the other side. Same thing. Okay, one more time. What does feel easier for you, left or right? Or is it same?
Almost similar, it feels to me, but the right one could go a bit further. But maybe that was because of the rib cage.
Yeah, there was much more turning in the right hand than in the left one.
Yeah.
And also the lifting of the rib cage was more pronounced on the right one. So in the end, you feel maybe you can go further, but it was by compensation and not by real movement. The real movement already stopped around 90 degrees on the right. And you could go further on the left without turning around.
Okay, yeah.
Good, let's take the arm out exactly to that side. Maybe I'll go here for a moment.
Is that in line with the shoulder?
Yes, that looks good. So you release really the shoulder down, you make it heavy, and then you take the hand forwards. Or backwards, whatever you want first.
Forwards, okay.
Yes.
Yeah.
That's it?
That's it.
Okay. Coming back, going back. Okay, let's do this one more time. We'll just change angle. First come really, yes, and then you go in one more time. Make sure the hand goes forwards, not outwards. Let's do it one more time properly. Good. Bringing it towards me. Exactly. Okay.
My shoulders lifting off.
Okay. Good. Other side. That's lifting, huh? Okay. Going to the back. Okay. I'll change angle and we do it one more time. Make sure we release first. Okay. And then you go in. Okay, good. I will just be behind your head for a moment. You just release your arms down. I want to have a look at your rib cage from this angle for a moment. That I can really see, okay, do I feel a difference between left and right? And try to just breathe very deeply, a couple of breaths, that I can see how with the breath, the rib cage, the belly are moving. Can you try for a moment to practice a diaphragmatic breath, that you want to breathe your lower ribs away to the side? Yes, exactly. Good. Slowly release. Good. I will place my hands for a moment onto your lower ribs and you just breathe my hands away, okay? One more really deep breath. Nice. Okay, I'll say something about this after. We will go into kind of like a yoga pose, a bridge pose, so that you stand your feet onto the ground and you're just lifting the pelvis high. And you're lifting the chest also as much as possible, just lifting things up, feet about hip distance apart, exactly, and just lifting up.
Yeah, hands on the floor.
Whatever you want. You can grab the mat, you can even interlace them, whatever you prefer. I just want to see what the rib cage is doing in this position. Just lifting the pelvis off, exactly, good, exactly. All right, slowly coming back down from there. Good. Okay. Nice. From there, lengthen out the left leg, the left one, yes, and take the right one into a 90 degree angle. Lifting it up. Yes, exactly, like this. Okay. You will take your own hand here in a moment on the inside of the knee. And then from there, you take the foot out as far as you can to the side without moving the knee. This is why you will place your hand there. All right?
On an angle.
Yes, it's just a movement like this without moving the knee.
Okay.
It's quite challenging. Actually, I need to be there that I can see it. If it's not happening, that's okay, yeah?
Okay.
Good. Exactly. Taking the foot out to the side. Yes. Nice. I like your control. You have a lot of control. Good. Nice.
I think now I move the knee a little.
Yeah. Let's do it one more time just to check. Let's try to go the other way. So you take your right hand to the outside of the knee, and then you take the foot inwards.
I can move the ankle though. I shouldn't.
You can. Okay, let's try one more time. Yes. Good. Okay. Slowly releasing this leg. Let's do the same thing on the other side. So exactly, right hand there, and then the foot is coming out. Coming to 90-90. You can even take it a little bit lower. More or less. Exactly. Good. And then taking it out. Yeah. Good. Slowly coming back in. Let's do it one more time. Yes. Nice. Okay. And then change sides. Good. Doesn't really want to. Try one more time. Yeah. Okay. Good. Let's release and find your way up back to standing for a moment. Good. We will do two last things. The first thing is going into a squat, and we do this very like gymnastics-like. So you bring your feet more or less hip distance apart, you bring your arms in front of you, and then you start to squat down. And you squat down as far as you can. If you can go all the way to the ground, you go all the way to the ground. If you feel like you're falling, forwards, backwards, you just come back up. The important thing is slowly.
Oh, okay.
So coming to the mat and
Feet hip wide apart?
yes, let me first see it from the side. Okay, slowly arms in front of you and then just squatting down. Good. Okay, then come back up. I will have a look from the back for a moment. Maybe just step a tiny little bit further forwards. Yes. And then we do the same thing one more time. Okay. Good. I will see it one last time from the front. And just squatting down. Okay, slowly coming back up. You notice how your feet are. I want to keep them on the ground, but I'm falling outwards. Good. I'll tell you in a moment. The last thing that we do is going into a forward fold. But this is not going to be a yoga forward fold, but it's a forward fold where you just allow yourself to hang. So you want to keep your legs quite long. If there's a micro bend, that's okay, but don't go into too much bending. And then you just start to roll in. So taking the chin down and allowing yourself to roll, 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 roll. I do it a little quicker than you will do it. And you will feel there's like a moment where you feel like if you're only surrendering to gravity, it will stop there. For sure you can go further, but this is not the goal. It's really when gravity is holding you, where are you stopping? And then you just hang out there for a moment. Good. Exactly. Slowly bending in. Try to round, 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 round. Good. Stay there for a moment. So in this upper part here, you have a very nice rounding of the spine. This is exactly what we want. Then you have a part here where it's kind of straight, which means there's too much compression. It should be able to round as well. Then in the lower back, you have a part where it's really going inwards, like you still have an arch, although you're in a forward fold. This is a problem because it shows us that there's so much compression that even if you're bending forward, the spine is not able at all to find a rounded position. Yeah. Does this resonate? Yeah? You can slowly come back up. All right, good. So, what did I see? What you already know is that you have this anterior pelvic tilt. So the whole pelvis is kind of tilting forwards. What is the consequence from this? First of all, the consequence is what I just said, that there's a lot of compression here in the lower back because the whole spine, the lumbar spine, is getting compressed together when the pelvis is tipping forwards. Another consequence from this is that you have lost most of the rotational ability of the hips. This was the test when we had the knee safe and we were trying to take the foot out. You had amazing control. Most people are just like, "Floop." But it also did show us that there was very little range of motion actually possible. Interestingly, you have a little bit more range of motion inwards into internal rotation, which means taking the foot out. This is for adults rather uncommon. For most people, it's the internal rotation that is like 0, 0, 0, and they have a little bit of external rotation. What does this mean? External rotation means that the pelvis is able to take the big bones outwards. Internal rotation means bringing these together. And then, of course, this goes together with the movement of the thigh bone. Mm-hmm. So what is happening from what I see and from the results of the tests is that your whole pelvis tipped too far forwards. As a result from this, the pelvis opened up into a lot of external rotation. Mm-hmm. Now, you cannot access any more external rotation because you're already there. Which is also something that I see when you lie flat on the ground. Your toes immediately do floop, they go out to the side. Yeah. You notice this in Shavasana, like, weep.
You've done too many Shavasanas.
Exactly. It's not Shavasana fault. So it's like, okay, you go forward and then everything is like pulled outwards. Mm-hmm. This is why going further outwards for you is almost impossible. Okay. But you have a little bit more motion towards the inwards rotation, but it's not enough. Mm-hmm. So you seem to be kind of stuck here in this open position in the front. And what goes along with this is a lot of compression in the back, because if the big bones open, then we have a lot of compression here around the sacrum area. Mm-hmm. So you have compression horizontally, this way, and then vertically as well. And this is why you're so much stuck in this anterior pelvic tilt, because it's like both ways that there's a lot of compression. And what I could see in the forward fold is that in the lowest part, it's really so strong that you stay in the back bend, although you're in a forward fold. So as long as this is the case, it will be very difficult for you to find a more neutral position in the pelvis, which you need to find the rotational ability again. Mm-hmm. Another consequence from this is your rib cage. Take a look at your rib cage for a moment. When you just stand like this, I mean, you're rather skinny, but still I can see your front ribs popping a little bit out. Yeah. And when you were lying on the ground, the lower back and already the mid back, they were not flat on the ground, but it was already pushing you out. So your lower ribs get constantly pressed to the front. And it's not very extreme for you. It looks like these lower ribs are a little bit more opened up. Opened up, what I mean is they are kind of having a little bit more space around them. So when you inhaled, there was movement that was happening, but it was not that the ribs really opened up much more and got closer together when you exhaled. It was more just the movement to the outside and to the inside, and not so much this open, close, like a fish, you know.
Okay, yeah.
This is what we want to happen. And this is absolutely normal, because when you have a lot of compression in the mid-back, it's just pushing you forward, and then these ribs already start to open more. However, in the upper part of the rib cage, it's the opposite. The ribs are very closed up. Why do I know this? Because when we did the rotational ability, your ability to go forwards was quite limited, especially on the right, but also on the left. And this is always a sign that there's too much compression in the front of the rib cage in the upper part. And it's totally normal that this is more on the right-hand side. But this also explains why you have the right shoulder that is a little bit lower than the left one. And it is probably linked as well to the jaw being pulled a little bit over to the right hand as well. In general, all that I'm saying, it corresponds to, first of all, the natural asymmetries of the human body. That this right side is quite compressed, is quite normal. Most people have quite a lot of asymmetry in the pelvis as well. You have some, but it's not super extreme. But the left side of the pelvis is in a little bit more external rotation than the right one. Okay. Because the right one had a little bit more ability to rotate, and you could feel it when you were lifting your legs as well, that the right one was a little bit easier for you. Yeah. And yeah, so it had a little bit more movement, but in general it's both sides of the pelvis that we need to bring backwards, and at the same time you need to learn how to stack the ribs above the pelvis. Why? Because otherwise every time you're breathing, right now I saw you are mostly a belly breather, right?
I guess, I don't know. I don't always pay attention.
The problem with this is that if you already, I have it as well, so if you already have this anterior pelvic tilt and then you inhale, you push the pelvic up, and then you push everything forward, yeah, a little exaggerated. But this is why you would want to work really on extending the ribs. Because if you just push the belly forward, it is just pushing you towards where you already are. So you would want to work on, okay, bringing the lower ribs back, bringing the pelvis back. How can we do this? Stop yoga. No. So first of all, hamstrings, hamstrings, hamstrings. Okay. The hamstrings are absolutely essential. Why? Because the hamstrings, they are attaching here at the sit bones. And if your hamstrings are very long, which is classical problem of a yoga practitioner, you can go very easily into this forward fold. But the hamstrings don't have the ability to pull the pelvis backwards. The moment the hamstrings are strong and reactive, they pull the pelvis backwards. And the same thing goes along with the side abdominal muscles, so the ones here. If they are strong, they pull from the top. And they will also allow you to help you bring the ribs that are popping out a little bit further backwards. So this will be the most important thing in terms of strengthening hamstrings, side abdominals. The left side a little bit more than the right, but the difference is not super pronounced. And then, of course, the opening of the lower back. I will show you a few things for this. We will start, oh, I forgot to take a break. In a position lying on the ground with the wall. I will show it one time and then you do it. So you come to lie down and you bring your feet onto the wall, making sure that the toes are pointing upwards. And you bring the brick in between the knees so that the knees are hip distance apart and the feet are hip distance apart as well. From there, you want to push the feet into the wall, making sure that the mount of the big toe, the mount of the pinky toe and the heel are in touch with the wall. Especially for you, mount of the big toe. Why? First of all, the mount of the big toe always wants to come off from the ground. But second of all, because the mount of the big toe is a sign for internal rotation at the hip. And you're in external rotation. So you want to give your brain a sign, now let's go into internal rotation. Okay. So you give a little bit of pressure into the wall and then you start pulling the feet down on the wall. Without the feet really moving, they stay in the same place, but it's like you want to pull them down. This will activate your hamstrings in the back. From there, you draw the navel in, you round the lower back as much as you can to then tilt the pelvis slowly off the ground. And all the time you keep pulling. And you find a position where you feel like, okay, this I can hold, but it's a little bit challenging. And then from there, we will add on a reach with the arms. For this reach, it's important that you really take the shoulders off from the ground. And then you want to practice a diaphragmatic breathing so that you get the expansion in the rib cage here. When you're really, really reaching far, there should be a little bit of a stretch here in the back that is happening. Mm-hmm. And important, the lower back is really, really round. Let's try this. So you come onto the mat, coming to your 90-90. Maybe we need a pillow for your head. It's okay? Or
I think it's okay.
Okay. Come a little bit closer, yeah. Mm-hmm. Wait. Good. I give you the break in between. Good. Making sure that the toes are pointing up. Exactly. Go to the other side for a moment. Make especially sure that the right one is the one that is really, really pressing the mount of the big toe. Maybe just doing this already feels like, oh, this is weird.
Yeah, it feels very different.
Yeah, exactly. So first of all, just take a deep diaphragmatic breath here. Maybe even placing your hands onto the lower ribs to really feel the movement that is happening there. Exactly. Relaxing as much as possible the throat area, though. I know this is always challenging when you practice diaphragmatic breathing. Yes. Good. Try to release the toes. Yeah. Good. And then keep the pressure of the feet into the wall and start pulling them a little bit down to feel activation. Yes. Nice. Good. And then once you feel ready, you round the lower back, and it's the pulling down of the heels that is helping you to lift the pelvis up. Yes, good. Keep pressing them out of the big toe. Good. Deep breath. Good, nice. How does it feel in terms of engagement from 1 to 10?
I don't know, 7?
Okay. That's good. Then we stay there and you just reach the hands high into the sky. Really reaching the fingers to the sky that the shoulders are lifting off. Good. And now deep, deep breath here. Yes, very nice. Keep pulling the heels down. Remember the right mount of the big toe. Mm-hmm. Mm-hmm. Good. Good, good, good. Deep breath. Nice. Very good. Last moments there. Keep pulling the heels down. Deep breath. Good. See if for a moment it's possible to lift the pelvis even a little bit higher. Yes. Deep breath. Good. And then slowly release it down. Good. Take a deep breath in between. I still want to give you a pillow. Even though you don't want one. Let's take it under the head. Okay. We're going to do the same thing one more time.
Yeah.
This time, once you're in the lifted position, you try to just lengthen out the right leg. The left foot stays on the wall. The left heel is really pulling down very, very strongly. If it's not possible, you bring the foot back. But let's try, okay? Lengthen means just up, like this. That the brick stays in the position, that you just lengthen it out. Good. Let's do that. Staying in touch there, good. Lifting up, nice, I can see the engagement there. Good. Keep the lower back as round as you can. Yeah, good. Then see if maybe it's possible to lift this leg off. Yes, good. Keep pulling down the heel here. Feel the hamstring, nice, good. This should be quite challenging now.
Yeah.
Good, lift up the arms high. Yes, last moments there. Deep breath. Good. Deep, deep breath. Yes. Nice. Keep the lower back round. Last moment. Good. And then slowly release. Good. This is something to do. You can do it on both legs, but you would want to do it a little bit more on the left. Let's say for you it would be like, I don't know, when you do 2 on the right, you do 3 on the left instead.
Okay.
So there's a little bit of difference, but it's not like extreme.
You mean the lifting?
The keeping on the wall, the engagement part.
Okay.
Yes. Okay.
Okay.
So clear so far?
Yeah.
Yes? Okay.
I definitely feel it in the muscles as well.
Yeah. All right. From there, let's just go for a moment. I'll take the brick out. Into, you can just push yourself away from the wall. And we will go to the left-hand side for you. And we will just go into a side plank. I'll just, yeah, maybe turning this way. Yeah, it will be nicer, exactly. Because I can take the pillow away. Good. Exactly. You can come onto the lower arm, exactly, just putting the lower arm onto the ground. Exactly, putting the feet one on top of the other, and then just for a moment lifting up the pelvis from the ground, coming into a side plank. Good. If you want, exactly lifting the other arm. And then you allow the pelvis to dip down a few times and to lift it back up. Yes, exactly. Good. Deep breath there. Good. 2 more. Good. Feeling the side?
Yeah.
Good. Slowly coming back down. Nice. Take a deep breath in between. Good. This is something you would also want to do on both sides, but a little bit more on the left. Since you seem to know this exercise, I want to give you another one. Maybe I'll just come onto the mat for a moment that it doesn't look weird for the video.
Yeah.
So, you will want to come this time onto your hand. You decide if you want to have the hand facing away from you or forward, whatever feels better for your shoulder. And you come into a position where you bring the left leg behind the right one. So your right foot will be in front of the left one. You come up into your side plank here, and then you stretch out the other arm. And then from there you start to bring the right elbow and the left knee together, joining them together but without collapsing downwards. So you really stay in this open position, and then you lengthen out. You can release the foot back to the ground, no problem, and then bring it together. Lengthen and bring it together. All right? Let's try that. Go there. Good. Come onto the hand that, yeah. Otherwise you don't have a lot of space. Good. Left foot behind, right one a little bit in front. Keep both legs long. Yes, exactly.
Should the hand be underneath the shoulder?
More or less, yeah. Good. And then you lengthen out that arm. Good. And now you bring the elbow and the left knee together. Yes, but stay open in the chest. Good. Exactly. Nice. Let's do 2 more. I'll just go behind you. Staying open there. Stay open. Yes. Good. One last one. Maybe you can even stay for a short moment there. Good. Deep breath. Okay, now we need to do one last one.
I think I'm falling.
You're falling. Okay. Yes. One last one. See if you can hold it just for one breath. Good. And release. Nice. Woo, deep breath. Good. This is a really good one for your side ups.
Yeah.
To help you bring the rib cage and the pelvis into the right spot. For you, what you can focus on when you're doing this, I know at the moment it's just like, okay, I need to get it done. Once you feel more stable in this, notice what the lower back is doing. Okay. If you really keep it long, or if you start to go a little bit into arching or something, because right now the tendency is to round a little bit the upper back. Mm-hmm. You would want to keep the upper back long, but instead maybe go a little bit more into lengthening of the lower back.
Mm-hmm. Yeah, I needed to take care to my
fall, yeah.
So I was a bit focused on that.
It takes a little bit of practice, yeah. Okay, let's come up to standing for a moment. And let's go for a moment towards the wall. I will show you first. So, we want to have a little bit of opening for the chest area, for the right side of the trunk. And at the same time, we want to bring length into your back. Mm-hmm. So for this, we come into a variation of a forward fold. Your hands are shoulder height on the wall. And first of all, you just walk yourself backwards into a forward fold. For you, very important, you want to make sure you bring the toes forward, but the mounts of the big toes are really both pressing into the ground.
Okay.
A little bit of engagement in the thighs here, and then you want to draw the navel in so that you round your lower back a little bit. Really pushing your hands into the wall. Feet are more or less under your sit bones. And just practicing some diaphragmatic breathing here will already feel probably very nice. And then we go from there into releasing the left arm down, and you're looking under your right armpit. Really releasing this down, keeping a little bit of rounding in the upper back. So you hug a little bit your sternum in. And then from there, bring more length into the right side by bringing a little bit this side of the pelvis backwards. And just hanging here. If you need to bend the left knee, that's absolutely fine. But stay in touch with your right mount of the big toe. And then it stays in touch as well, but I'm less concerned that you will lift it off actually. I think if you lift one off, it will be the right one. But the important thing is here that you stay in this little bit of rounding, and that the rounding is coming more from the mid-back actually, that you really press a little bit the end here, the base of the sternum up. And just hanging here, breathing deeply, practicing the diaphragmatic breathing, that you feel expansion here on the right side of the rib cage. Good. Let's try. So start coming first completely to the wall that you really measure, because we have the tendency to take the hands too low. Take them a little bit higher. Yes, good. Then you walk yourself backwards. Good. All right, take the feet a little bit further in front, like here. Yes, good. Now bring more rounding into the back first. Yes. Good. And then yoga-like external rotation in the upper arm. Good. First of all, take a few deep breaths here. Breathing my hands away. Good. Do you already have a stretch like this?
A little bit in the arms.
Okay. Good. Breathe more. More. Deeper. Good. Last moments here. Good. Nice. And then without changing anything in the right arm, just remove the left arm from the wall, release it downwards. Yes. Allow yourself to really hang on this side, look under the right armpit. Good. And pushing this part upwards for you. Yes. Good. Deep breath here, especially into the right side of the trunk. Yeah, I can feel the ribs moving. Good. How does that feel?
I can feel it in my lower back.
Lower back for you. Okay. See for a moment what's happening if you on purpose go a little bit deeper into the twist. Pushing the left shoulder a little bit down, and then see if you can pull the right hip a little bit further backwards. Good. Maybe, bend the left one. Exactly. Any difference? Only lower back. It wouldn't be a surprise if it's only lower back for you.
No, also in the side body.
Okay, nice. Good. Few last deep breath here. Nice. And then slowly pushing yourself out, coming out, bending the knees and directly allowing you to go into a forward fold here with the pelvis tilted as far backwards as you can. Just allowing yourself to hang. Good. Bringing a lot of rounding here into the back. Round. Good. Do you get a stretch here in the lower back? Yes? No? Yeah? Okay. Because sometimes in the beginning the body doesn't allow the stretch to happen, and then people are like, no, I don't get a stretch. Okay, perfect. This is a healthy way for you to practice forward folds. In yoga, in everyday life, in whatever. you want to do whatever else. Just the last couple of breaths there. If you want to interlace the hands and elbows, feel free to do so if it's more comfortable for you. Last moments here. I'm going to touch there. Do you notice what's happening in your hamstrings?
Yeah, they are definitely, I don't know in English. Well, I feel that they are not tense, but
they are engaged. They are engaged, exactly. Perfect. Taking a last deep breath here. Good, and then slowly coming back up. Yes, very nice. Good. I would like to show you one thing on the ground, and we will take the brick for this. You will come into more or less like a child's pose position, and you will have one brick. We will do it on the right side. So right arm on top of the brick. And when you come into your child's pose, for you, every time, try to draw the navel in. Like you want to really round the lower back. I know it's challenging to be in a child's pose and not fully lengthen out, but draw the navel in as much as you can. The arm needs to be completely lengthened out, and I personally prefer to really come only onto the fingertips, but press them actively into the ground. From there, you then go into a twist in this position. So you're kind of twisting yourself over to the right. And here, most likely you will have to give a little bit of rounding as well to really get a stretch. And you decide how far you go. Often, it doesn't have to be like really going very far down, but rather you want to give a little bit of active pressure here from the lower hand into the ground. And then, very important, the deep diaphragmatic breathing. If you want to release the head, you can just release the head, no problem. And the goal here would be to get the stretch as well here in the front part of the chest. So see if you can find this. Sometimes you need to twist a little more, a little less. Maybe you need to round a little more. See what's happening. If you can't find it, we'll troubleshoot.
Okay. The toes can touch?
Yes. So this in front, exactly. Good. Coming a little down there. Nice. Deep, deep breath. How does it feel? Getting any stretch there? Yeah? Okay.
Yeah.
Okay, good.
In the lower back because I'm trying to round it.
Yeah. Do you have any sensation in the right side of the chest in front?
Here?
Here? Okay. Maybe this is the limiting factor, really, the side, and it's not only the front. Good. Pushing this away from you. Yeah. Good, good, good. Nice. Last moment there. Deep breath. Breathing the ribcage away. Good. Good, 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 good. This is one of the positions, the more often you do it, the deeper you will feel probably that there's stretch happening. And in more places you might feel it as well. Good. 2 last deep breaths here. Very nice. Good. And then slowly coming back out. Good. All right. I think this is the most important part for now.
Okay.
How does it feel? How do you feel about it? Any questions so far?
I feel really good. I feel the work on my lower back
Lower
for sure.
Yeah.
Because I'm not used to it.
Exactly.
But it feels very good. Yes.
Okay.
And I can feel the effect.
Perfect.
Of the exercises we do.
Nice. I would love to show you something else, but I forgot to take what I really need to take for this. I'll try to set it up a little differently. So you will lie on your left hand side and you will bring this under your belly. So it's not touching the ribs and it's not touching the pelvis.
On the left hand?
Left hand side. Yeah, that would be nice, exactly.
Really on the side?
Yeah, on the side. Exactly. Maybe go a little bit backwards, that when you bring your legs into like 90-90, they are still on the mat, it will be more comfortable for you. Exactly. Good. Bring it a little lower. Yes, there. And just lying down. Wait, I give you one pillow and I take the other one. Good. All right. Now in this position, we have something underneath the belly to push a little bit the belly up. It could be even a little bit higher for you, because we want to have both sides of the pelvis that are really stacked, one on top of the other. And your job is just to relax, and for you a little bit of rounding in the lower back would be nice. That you bring it a little bit, yeah, exactly. Maybe you can even take the knees a tiny bit higher, that automatically it might go into a little bit more rounding. Good. Now, usually I place a bag of rice there, like any sort of weight is good. So right now I'm just going to press a little bit onto your pelvis, yeah? And the idea here is that I want to press a little bit your pelvic bones together in the front, that it can open up in the back.
Okay.
And it will be okay if you feel like this knee needs to slide a little forward, if it's a little uncomfortable, if one knee is right on top of the other. The right one can slide a little bit forwards. That's okay.
So far it feels fine.
Feels okay?
Yeah.
Good. Taking a really deep breath here. Maybe closing your eyes for a moment. Still practicing the diaphragmatic breathing.
Good reminder, yeah.
Good. Very nice. And since it's one of the favorites of all of my clients, if that is all right for you, I will sit down on top. Okay. Just to bring a little bit of extra weight onto your pelvis. How does that feel?
Feels good.
Good? Okay. Then let's try to breathe really down into the lower back here. Breathe in very deeply. Good. Nice. Take one or two more deep breaths. Good. Nice. You can feel that there's some movement happening in the lower back when you breathe, but it should be much more.
Okay, it's only a little.
Yeah. But the breath can really help you to open up the lower back. So intentionally guiding the breath into the lower back can really help. Very nice. Good. All right.
11 correct.
Yeah? Perfect. Amazing. That's really good. Very nice. All right.
Thank you.
Well, thank you. Let me know if there are any more questions, anything.
So far, it's clear, I think.
Okay. Amazing. Then thank you so much.
Thank you.
And
really appreciate it.
thank you. Thank you for doing this.